It's so great to be here tonight to meet old and new friends. Thank you for having me here. So,
I can hear you.
You cannot hear me? Okay, already finished my presentation. Okay, I see. Is it better?
Yes.
Okay, great. Again, thank you very much for having me here. Tonight, I'm going to talk about this study, which is actually inspired by my personal experience. 5 years ago, when I moved from Philadelphia to Maryland, I was looking for a primary care physician to take care of my family. And it turns out that I went to the insurance company's website and I saw hundreds of physicians listed there. Guess what? The information there is only about name, address, graduation, school, and name again. You just do not see any information about the quality of individual physicians. Looks like there's an assumption that all physicians are equally qualified to treat us, which turns out to be a really bad assumption. So, studies have shown that physicians are like us, right? They have the body, and they are more likely to take certain drugs because of easier access. And then they have significant mental disorders, and then 3 to 5% of physicians actually are unfit to see patients. And so this is really quite alarming, right? Unfortunately, when it comes to trying to select good physicians, or at least avoid bad physicians, you are out of luck. We're still in the dark age. Fortunately, here we are at Health 2.0, right? So we're in the Web 2.0 era now, and patients are helping themselves. Just as what they do on Amazon.com, they can review books very easily. Now, there are over 40 different websites that allow patients to read their physicians very easily. And this includes several leaders here, and also Angie's List, which is famous for rating plumbers. They are rating physicians. Zagat, which is famous for rating restaurants, they are rating physicians as well. So, up to now, this online physician ratings by patients looks to be the only public channel for us to discern individual physicians' quality. And then there's a study showing that 1 out of 6 of the US adults have consulted these ratings with the physicians. Obviously, right, these ratings have created a lot of anxiety among physicians. So American Medical Association actually expressed concerns, saying that these ratings are just one channel for disgruntled patients to vent their anger. And then there are even lawsuits from physicians against these websites. So far, we have very little understanding of this Health 2.0 phenomenon, and this study is trying to figure out some of the basic facts, and we do some analysis on that. So first thing I want you guys to know is that these physician ratings are really growing very fast. So this is from readmds.com, one of the oldest and the biggest website. It started in 2004. So what you see is that from 2005 to 2010, the annual growth rate of ratings there is 94%. And now, by January 2010, what you have is about 360,000 ratings already. And then looking at the numbers of physicians who have at least one rating online, this number grows significantly as well. Now it is reaching 120,000 physicians, which is about 1 out of 6 of physicians in the US. So this is from one website here. When you look at about what kind of physicians are getting ratings, then this is a huge dispersion between them. OBGYNs are much more likely to be rated online than surgeries or surgeons or primary care physicians, which we don't know why, but this is the fact. If you look at the distribution of the number of ratings per physician, this is something that's really alarming. That is, 46% of physicians only have one rating there. So this online rating thing is really at its very early stage. And then 12% of the physicians have at least 5 ratings, which you can regard this as a more stable matter. So fortunately, over the years, number of physicians who have at least 5 ratings have grown steadily. And then we expect that more and more of them will accumulate more ratings over the years. So this is the biggest surprise from our study. That is, although AMA concerns that online ratings are about complaints from patients, this is not supported by the data. What you see is that about half of the physicians get a perfect out of 5 out of 5 scores. And then the average rating is 4 out of 5. So these online ratings really are not about complaints from patients, but rather it is about patients recommending good physicians. And then, yes. So there are some evidence about whether these ratings are correlated with the quality of physicians. What you see is that if a physician is board certified, then the rating will be higher. If he received the education from top 50 medical schools, the rating will be higher. If that physician has a malpractice claims, then the rating is lower. So there's some evidence that these ratings do reflect the quality of the physician. And if you compare these online ratings with the offline patient surveys, we do see a very high correlation. And although it is noisy for obvious reason that the number of ratings is still very low. So overall, the conclusion is that the online ratings are growing. It's growing significantly, and we do need to pay attention to this, given that this is the only channel for us to learn about physicians. Thank you very much.